Hi, I'm Susan Etheridge. I'm a pediatric electrophysiologist and the vice president of the SADS Foundation, and I'm going to talk to you a little bit about long QT syndrome. I'd like to make a point that if you have long QT syndrome, if you've been diagnosed with this condition, that this is a genetic problem and it is not something you can grow out of. In the past, it was more difficult to make this diagnosis, but now we have more sophisticated genetic testing and we can be more certain you carry the diagnosis of long QT syndrome. Not everybody with long QT syndrome is the same. Not everybody has the same risk. And some people actually have a risk that varies over time. Some patients with long QT syndrome can actually participate in sports. This is a decision that needs to be made between the patient, their parents, and their physician. What we do know that is if you have long QT syndrome and you have an event, the thing that would be life-saving for you would be an AED. Interestingly, most patients who have long QT syndrome, who have events, don't even know they have long QT syndrome. So again, an AED available in a sports act, an AED available for situations where children are gathered, and like schools or sports arenas would be very helpful and life-saving in this situation.